welcome to the first of Comcare's Psychological Health and Safety Forums for 2024. I'm Andrew Crane, Director of Comcare's Education and Engagement team, and I'll be your host for today's event. You might have joined us or watched the last Psychosocial Health and Safety Forum that we hosted back in October last year as part of Safe Work Month. That was the first in this series using this particular format. And the response to that event was so overwhelmingly positive that thanks to your feedback and the survey results that many of you contributed to, we now plan to host these forums twice a year moving forward. Firstly, though, on behalf of Comcare, I'd like to acknowledge traditional custodians of the lands on which we're all virtually meeting today. I'm joining you from Canberra, and I'd like to pay my respect to their elders, past and present, and acknowledge the contribution that they've made and continue to make. I missed that I'm on Ngunnawal country, so they are the traditional custodians of the land that I'm here on. So I'd also like to extend that respect to other Indigenous Australians and Torres Strait Islander people who are present today. So on to some housekeeping. I want to acknowledge all of you who've taken the time to be with us today for the forum. We recognise that each of us, myself and all of you, have got a unique perspective that can offer insights into the topics that we'll be covering here today. We've all got a background of lived personal and professional experience. So we're keen for you to engage, share your insights, ask questions and get involved as best we can within the constraints of the platform that we're working through today. So we really encourage you to participate in the conversation via the chat. However, we do ask that you always keep your contributions respectful and on topic. We've also got some polls, and one of the first polls is coming up now to help engage. And we're asking in one or two words, what are you hoping to get out of today's forum? If you're using the Microsoft Teams app, there are instructions on the screen now on how to turn off the chat notifications during the webinar, as some people find these distracting. We're also really pleased to have a lot of questions that have come through the registration process. And we've done our best to consolidate these into questions that we'll put to our presenters today. So whether you hear it directly responded to or not, I can assure you that none of the questions are wasted, as all of them help to inform our guidance materials, our future events and content that we develop for you. The forum's being recorded, which will only pick up the presenters and the slides shown on the screen. So you'll notice that your microphone and camera are not able to be turned on. For accessibility, the recording will also include the option of closed captions, which we're hoping to make available through Comcare's website in the next week. Before we begin, however, if you do find any of the content in today's session to be distressing to the point where you need to access support, we've posted links and contact numbers to support services in the chat if you require them. If you've got feedback to questions or suggestions for future forums, we really encourage you to complete the short 1 to 2 minute survey that you'll find you'll receive following the forum. And it's great to see so many of you starting to respond to the poll. Except I can't actually see the responses. So I won't make any comment on those responses at this stage because I haven't seen any of the ones popping up. But thank you for that. I'm pretty confident that we'll be able to deliver on most of those that you have put in there. There's another poll that will be going up, and that's a question about who's your regulator. Do you know who your regulator is? Is it Comcare? Is it Safe Work New South Wales, South Australia, Queensland, ACT, Victoria, etc.? Another regulator, perhaps? I know we have some guests joining us from internationally. Or if you're not sure who your regulator is, let us know that too. Now, to formally kick off our forum today, I'd like to introduce Comcare's Chief Executive Officer, Greg Vines, who'll give a short welcome and formally open the forum. Greg, I'll leave you to officially get us going. Thanks.
Okay, thanks very much, Andrew, and good morning and welcome to everyone. And it's great to see so many people joining us this morning. For those of you who are attending a Comcare event for the first time, thanks for joining us and a big welcome to you. I hope you get a lot out of today. And for those of you who have been with us before, welcome back and thanks for helping to shape this event. It's great to have you with us. And as Andrew said, the questions that have come in have really helped inform the direction that we take today. And I also note I could see the responses to the poll online and see that the largest word in the map there is knowledge. So I hope we're going to be filling you with a lot of knowledge today. I'm joining you from Melbourne, and so I acknowledge the Wurundjeri people of the Kulin Nations as the traditional custodians of this land, and I pay my respect to their elders past and present, and I extend that respect to Aboriginal and Torres Strait Islander people taking part in the event. As Andrew said, we're running this forum now as a biennial event, and it's great to see such strong attendance again. It's certainly clear that creating and maintaining psychologically safe and healthy workplaces is a significant focus for workers and employers in our Comcare scheme and of course, beyond our scheme. The purpose of these forums really is to try and clarify the regulatory requirements for compliance with the WHS laws. We also want to be able to provide some expert insights on psychosocial hazards. We'll also be aiming to showcase some better practice approaches and to discuss some case studies and really try and learn from some lived experiences. First, though, some brief context on why it's now more important than ever to ensure our workplaces are psychologically safe and healthy. All Australian WHS laws require that psychosocial risks to health and safety be effectively managed. But it's really only in recent times that we've had the changes to the legislative framework that spell out how these risks should be identified and controlled. The backdrop to this is a really challenging workers' compensation environment. Nationally, we're seeing a pattern of increased numbers of claims for psychological injury, and these claims typically involve more time off work and higher costs than the traditional physical injury claims. For example, in the Comcare scheme, around 1/3 of all of our claims that we receive from Australian government workers are for psychological injury. The median incapacity or lost time for these claims has been more than 30 weeks for the past 2 financial years. And psychological claims now account for just over half of overall claim costs, and they average around $350,000 each, and that's more than 4 times the $80,000 average cost of physical injury or disease claims. So it really is a critical time for duty holders to consider and review their approaches to managing psychosocial risks and fostering mentally healthy workplaces. This includes effective engagement and consultation with workers and a strong focus on prevention and early intervention. So we see these forums as a key part of Comcare's efforts to educate our stakeholders across the jurisdiction and beyond. And as I said, it's really fantastic to see the continuing high level of interest in these sessions. And today we've got another packed agenda. Amended WHS regulations that strengthen and clarify how employers manage risks for psychological health have now been enforced for just over a year. And this was a key recommendation of the 2018 review of the model work health and safety laws across Australia. You'll hear from our regulatory operations group on a range of the important work that they're doing in this space. There's also been major changes to Commonwealth work health and safety laws in recent months, and these have included significant increases to penalties under the WHS Act. For example, from July this year, the legislation will include a new offence of industrial manslaughter, and that will punish and deter the most serious breaches that result in workplace fatalities. Later in the forum, we'll be looking at some of the tools available for employers to survey, to identify, and to understand and manage psychosocial risks and harms in the workplace. Comcare's mental health and research team have published a comparison of 3 of these risk assessment tools to help employers consider what's the best fit for their workplaces. We certainly recognise that one size does not fit all. We are incredibly fortunate to be able to showcase these tools along with the experts that really understand their application in the workplace. This presentation includes experts from the Australian Public Service Commission's Mental Health and Suicide Prevention Unit and an organisational psychologist from the University of Adelaide, together with Comcare's own mental health and research team. Services Australia will also present a case study on one of these tools, the People at Work survey. We'll finish the forum today with a panel session that will take a deeper dive into psychosocial hazard identification and risk assessment, and this will include discussion on practical implementation and engaging stakeholders, and we'll be ending that with a bit of a Q&A session. I certainly hope the forum provides you with some of the valuable insights and the knowledge that you've been asking for, that you can take back to your workplaces to help encourage and enable safe and healthy work. So I'll now hand over to Justin Napier and Luca Campbell to give an update on some of the key initiatives and priorities for Comcare's Regulatory Operations Group. Thanks very much for joining us, and I hope you do get a lot out of today's session. Thank you.
Thanks, Greg, and hello to everyone. Luca and I are in Sydney, so we're on the land of the Gadigal people of the Eora Nation, so pay our respects to elders past and present. So let's just begin with a quick overview of Comcare, just to explain who we are, what we do to make workplaces safer. So Comcare has two high-level functions. We are a regulator under the Commonwealth Work Health and Safety Act, and we are the Workers' Compensation Authority under the Commonwealth Safety Rehabilitation and Compensation Act, the SRC Act. The Work Health Safety Act aims to protect workers and other persons from harm to their health and safety through the elimination or minimisation of risks arising from work. The workplace rehabilitation provisions of the SRC Act aim to maximise an injured worker's chances of an early and safe return to work. Incidentally, the federal government has announced it will be undertaking a review of the SRC Act commencing in the coming months. So look out for this if you have an interest in this aspect of Comcare's work. Now, our jurisdiction under these two statutory functions overlaps, but not completely. As you can see shortly, I hope, on the slide, which explains our jurisdiction. However, Comcare's purpose, which unifies both our WHS and workers' compensation functions, is to promote and enable safe and healthy work. And I note a number of people in attendance today are not in the Comcare jurisdiction. So you're very welcome to join us today, but please check with your relevant state or territory regulator for specific advice, because there can be some differences across jurisdictions. Now, the Work Health Safety Act requires that certain types of incidents are notified to Comcare. In 2023, Comcare received a total of 1,532 notifications. And the slide, hopefully you can see it shortly, breaks down these notifications by location and nature of incident. In terms of location, it is noteworthy that despite a large proportion of our jurisdiction being Canberra-based, New South Wales had the highest number of incidents reported, followed by Victoria and Queensland. And we can see also that the most common incidents are being hit by moving objects and heat and electricity and other environmental factors. There were relatively few incidents of a psychosocial nature notified to us in 2023, 77 in total. This is because the current notification requirements are quite limited in regards to psychosocial hazards or incidents. However, amendments to the notification provisions are currently being progressed by Safe Work Australia. A quick update on some of the recent WHS law reforms. So late last year, the Commonwealth Parliament passed the Fair Work Legislation Amendment Closing Loopholes Act. This legislation amends the Work Health and Safety Act of 2001 and as of December 15, 2023. So there are four key amendments which I'll briefly go through now. The first amendment, as Greg mentioned earlier, is increases to penalties available to the judiciary for offences under the Act and indexation of the penalty amounts. This was a recommendation of the Boland review of the WHS laws occurring in 2018. The second amendment is the new offence of industrial manslaughter, which will come into effect from 1 July this year. This was also a recommendation of the Boland review and aligns the Commonwealth WHS laws with the majority of other states and territories. The third amendment is the establishment of a Family and Injured Workers Advisory Committee to advise Comcare and the Minister. The Department of Employment and Workplace Relations are in the process of establishing this committee, which will commence by the end of this year. And the fourth amendment relates to corporate criminal responsibility. This is in response to a report from the Australian Law Reform Commission, and this extends the way that the courts can assign responsibility to a body corporate based on the conduct of people with actual or apparent authority. If you would like more information about the amendments to the WHS laws, please visit Comcare's website, where we have a dedicated page with advice and guidance for our jurisdiction. So I'll now hand over to Luca Campbell, who's Comcare's Director of National Regulatory Programs, who will share with you some information about Comcare's proactive psychosocial inspection program.
Thanks very much, Justin, and good morning, everybody. So as Justin mentioned, I'll be talking to you today about our psychosocial inspection program, which is an important part of Comcare's approach to preventing injury and illness arising from psychosocial hazards, and that ensuring that PCBUs in our jurisdiction are compliant with the work health and safety regulations relating to psychosocial risk management. There are 5 key aims of our proactive psychosocial inspection program. The first is to understand psychosocial hazard and risk management in the Comcare jurisdiction. The second is to improve compliance by providing advice specific to the needs of each PCBU, consistent with the Model Code of Practice. The third is to enable and assist work health and safety duty holders to achieve evidence-based management of psychosocial risks. The fourth is to support and build the capability of Comcare's inspectorate to regulate psychosocial risks. And the fifth is to develop an evidence base to inform future priority areas for improvement and training and resources across our jurisdiction. For each inspection that we conduct as part of the proactive program, there are 3 key stakeholder groups that we engage with. The first is Tier 1, which is our senior leaders, and we refer to this as our executive engagements. We conduct these engagements in a group setting using a semi-structured approach. And this means that we can ask questions about governance, leadership strategies and due diligence to enable effective management of psychosocial risks. At the same time, we provide advice and information to senior leaders about the regulatory requirements when it comes to psychosocial risk management. The second tier is where we engage with health and safety representatives and work health and safety personnel, a very important stakeholder group in terms of psychosocial risk management. And we engage with these people to understand the practical aspects of psychosocial risk management and how the systems are operating within the context of the PCBU. The third tier is where, very importantly, we engage directly with workers. So our inspectors conduct one-on-one meetings with workers to understand their perceptions of psychosocial risks in their workplace and to understand the effectiveness of the PCBU's training, consultation and other risk management systems. The engagements with workers are quite structured, and we do provide online and in-person options available for those engagements. At the conclusion of each inspection, our inspectors issue an inspector report to the PCBU. An example is on the right-hand side of the slide there. This summarises findings and provides recommendations and advice to the PCBU on how to manage how to strengthen work health and safety systems related to the prevention and management of psychosocial risks. The data from our proactive psychosocial inspection program provides us with some insights into the prevalence of psychosocial hazards across our jurisdiction. It is still a relatively small sample, and the visualisation on the screen here is based on responses from 147 workers that have participated in the program so far. As the dataset grows, we will have increased confidence in patterns and trends as they start to emerge from our inspection program. But with that being said, we can make some preliminary observations based on what we've seen so far. So we see that hazards relating to the design or management of work had relatively higher prevalence compared to workplace behaviours. And in some workplaces, this could be an indicator of latent harm or a leading indicator for some of those other hazards that may arise in more of a interaction type of environment. Lower prevalence, it's important to say, doesn't necessarily mean that those hazards are less harmful. So things like bullying and harassment, we know, can give rise to immediate injury. Whereas what we know with those other types of hazards relating to the design or management of work, the harm can often result from exposure over time or cumulative exposure. So what's important to recognise based on these observations is that it's important to take a holistic approach to psychosocial risk management. In particular, consider how hazards might interact or combine. So, for example, concurrent exposure to both high job demands and low job control, or exposure to traumatic events and material in an environment with poor support. It's also noteworthy that job demands here is reported as a hazard of concern amongst a high proportion of workers, and this is consistent with what we've heard from our previous webinars and our engagements with various PCBUs in our jurisdiction. So to help raise awareness of the job demands hazard in particular and what can be done to mitigate against it, Comcare has been working on a short video which we're hoping to play for you now.
Job demands are one of the most common sources of workplace stress. Both high and low job demands can create risks to health and safety at work. High job demands include excessive workloads or pressures, resource constraints, or unrealistic timeframes. Low job demands include repetitive or monotonous tasks or long periods without enough work, leaving workers feeling disengaged or underutilised. Unmanaged risk might lead to workers feeling disengaged or distressed. Over time, workers can experience depression, anxiety, fatigue, and diminished performance. Organisations can be affected by poor workplace culture, reduced productivity, high turnover, and increased worker injury or illness. Employers have a duty to eliminate or minimise risk to health and safety arising from psychosocial hazards, including job demands, as far as is reasonably practicable. Here are some tips on what you can do. Consult with workers and their representatives about job demands and encourage their feedback. Provide workers with any necessary training, information, and supervision. Ensure workloads are reasonable and realistic so workers have enough time to complete tasks. Allow regular breaks and provide job variety. Ensure the work environment is comfortable and reduce workloads that cause physical stress. If we work together, we can manage job demands to create and maintain safe and healthy workplaces. Resources for employers, managers and workers are available at www.comcare.gov.au/job demands.
So I hope you enjoyed that short video, and that was a preview mode. We will be releasing that on external platforms for you to share with colleagues and others that are interested in controlling this particular hazard. It's just important to recognise that providing advice and information is just one part of our regulatory remit. So we supplement that with other strategies to try and influence outcomes against preventing psychosocial risks, including from the psychosocial hazard of job demands. So I'd like to now turn back to our psychosocial program and provide a bit of an update on the evaluation of the program. So we recently engaged the University of Queensland to conduct an independent evaluation of our proactive psychosocial inspection program, looking particularly at the pilot mode of that program, which was carried out in 2023. The evaluation looked at program processes and resources and involved interviews and surveys with participants across all three tiers, which I covered off earlier in this presentation. The evaluation found that the program met its objectives and was perceived positively by both PCBUs and also by the inspectors that carried out the program. Of particular note when it comes to the feedback from PCBUs and workers, 92% of participants agreed their knowledge of the range of psychosocial hazards had improved. 85% of participants reported an increase in commitment to psychosocial health and safety, and 70% agreed that the program had assisted their organisation to comply. So we've received some recommendations and some suggestions for continuous improvement to the program, which we're currently working through in anticipation of scale up and full rollout of the program in the second half of this year. We're also in the process of creating a specific website for our proactive inspection program, where you'll find additional resources, guidance and information about our approach, and we'll be releasing that in the near future. Thanks very much for coming to today's webinar. We hope you found this regulatory update informative, and we hope you enjoy the rest of this webinar. If you would like any further information about psychosocial health and safety in the workplace, please do visit the Comcare website and search for psychosocial hazards, or follow the link on this slide.
Great. Thanks, Justin. Thanks, Luca. Again, lots of discussion in the chat there. Some really engaged participants with some of their own insights and reflections, some questions in there. It is pretty complex for Comcare to respond to many of the specific questions that do come up. So I would encourage you, if you do have questions relating to Comcare's regulatory approach, or you've got after some specific advice or guidance, to contact Comcare's WHS help desk. So that's whs.help@comcare.gov.au, where your questions can be considered and responded to appropriately. So now on to our next session, which is about psychosocial risk assessment in the workplace. In this session, we've got three speakers. We've got Dana Fawkes, Anne Wen-Pham, and Dr. Amy Zdow, who will be showcasing three risk assessment tools and their approaches. I'll start us off by introducing Dana, who will be leading this session, and introduce you to Anne and Amy. Welcome, Dana. With 15 years of experience in strategic research and cultural change initiatives in both the public and private sectors, Dana leads a research program at Comcare. It's designed to provide employers, workers, and other stakeholders with an evidence base that enables healthy and safe work. Projects have included developing and embedding principles for better practice EAPs, research into health and wellbeing of truck drivers, a pilot program for preventing workplace bullying. Over to you, Dana.
Thanks so much, Andrew. This is an area in particular that's seen tremendous growth in the last couple of years, so it's really great to be able to talk about it a bit more with this audience. We've just heard sort of Justin and Luca talk a little bit about psychosocial hazards themselves, and so I won't kind of go into much more detail on that or the responsibilities. But in this session today, we're going to talk a little bit more about some of the ways that psychosocial risk assessment tools can be helpful. So there are several tools that are readily available to help understand psychosocial hazards in the workplace, and the ones that you choose to use will be dependent on the needs of your organisation. There's no one-size-fits-all approach, so you might need to take a bit of time to understand the tools, what they can do, and whether they're the right fit for your organisation and its officers to discharge their duties. I might also emphasise that conducting an assessment or running a survey is not in itself usually sufficient or any kind of silver bullet to solving these problems or challenges. The tools that we're going to talk about today are a bit more like processes that can support the collecting of appropriate data about the work of your organisation and the risks inherent, and then helping you to use that to inform and take actions that can then mitigate the risks of harm. So just a sort of little reminder for everyone. The focus of today is going to be on three different tools. One is the People at Work tool, one is Address, and one is the Psychosocial Safety Climate. These are some of the primary kind of evidence-based tools that come with a lot of resources that can help support implementation in your organisations. So People at Work is funded by the work health and safety regulators across the country, and it provides really a free mechanism for employers to quantify risks and then take action to address them. Address is designed for public service employers, and it's really a model for understanding and responding to hazards. And then the psychosocial safety climate measure has been shown to be a lead indicator that can help prevent psychosocial hazards from occurring. On the Comcare website, you can find a summary table that really briefly describes these three tools and provides a bit more of an indication about some of the differences between them that might help you make an appropriate selection for what you need in your organisation. So, for example, the comparison table talks about the purpose of the tools, who they're aimed at, how they relate to the hazards in the model code of practice, and a few other features that might be helpful in your decision making. The website also points to some resources developed under the National Workplace Initiative that can help you think about what matters when measuring mental health in your workplace. There are some sort of unique factors to think about in that context. But I am pleased today that we're going to have Anne and Amy and Vicky a bit later to talk in a bit more detail about some of these tools and how they work. For now, though, before I hand over, I'm going to talk a little bit about the People at Work tool, and in particular, sort of how we use it as the regulator. As a bit of a brief introduction, fundamentally, it's a 5-step risk assessment process. So the website has tools and resources to guide you through these steps, and that really takes you from preparing your workplace through to running the inbuilt survey, then through to understanding your results and building an action plan, and then sort of guiding you to do the whole thing again at regular intervals. There's also regularly updated, frequently asked questions on the website that can support your implementation, and Comcare is available to support organisations in the Comcare scheme to work through this process and provide advice on how to best implement it. We've seen really great engagement with the tool so far. So it's been in place for a few years now, launched in February 2021. We've had over 200 registrations, and I think we're nearing or maybe have just passed about 10,000 responses collected. So I think that really demonstrates a need and particularly the value of the tool. We're also starting to see organisations run multiple surveys over time, so we're looking forward to being able to see impact of change over time. I think that'll be quite interesting. The People at Work survey itself assesses a number of the common psychosocial hazards across Australian workplaces, the ones you can see hopefully on the slide. It's grounded in the job demands and resources model of wellbeing, which is really explains how high job demands coupled with low job resources or low job resources result in work-related stress. Where we get to the point where to find well-being, we need to find that point of equilibrium between the challenges in our work and the resources that we have available to meet those challenges. So People at Work, the survey is really about helping you to quantify the frequency with which your workers experience these demands and resources. And that can kind of help you work out where work-related stress might be prevalent. So potentially it can be addressed before it can result in injuries or illness. We know, and the eagle-eyed among you will have noted that these hazards are not a perfect match with the hazards in the model code. That said, there are some elements of all of the things in the model code that are sort of captured within People at Work, but it's not perfect. There are conversations ongoing around if and how we could develop additional modules using validated scales that could be included in future updates of the People at Work tool. So it's a live conversation that will continue. What I thought I might do now is show you a little bit about how we look at the data. So as the regulator, Comcare has access to all of the data that is collected through the People at Work tool. I will emphasise this a lot because I know that it can throw people off, but please know that this is de-identified at both the individual level and the organisational level. So Comcare or other regulators has no way to know which data comes from which organisation. We cannot look at specific individual organisational data in the system. It's really just that high-level view. So the value, though, for us is in being able to understand that high-level picture of hazards being experienced across the jurisdiction. That can then inform our advice and education functions, for example, in a similar way to the way Luca was describing earlier. Now, I say high level as there are going to be some biases in the sampling due to which organisations select to conduct people at work and which workers select to complete the survey. What you're seeing on the slide here is kind of one way that we look at the data. I appreciate there's a lot going on, so I'll try and explain it. What you can see in the chart is all of the hazards measured in people at work. And so these are separated by, you can see the demands in the top half and the resources in the bottom half. The way we're showing this is green and yellow bars represent the level of risk that we're seeing in the Comcare jurisdiction for each of these hazards. And again, just a reminder where risk is calculated as a function of frequency of experience. So the more something is experienced, the more likely it will show up as a risk in this context. And then the grey bars that you can see represent national averages that come from all of the data in the people at work data set. Now, what I think we can pull out of this is a couple of stories. So one, there's nothing registering at high risk. So I think that's a helpful story. But we can see several coming in at that moderate risk that really probably need some action taken against them. These are things like emotional demands, overload, change consultation and job control, those sorts of things. If I look maybe at the top three, so think about change consultation, that's really talking about the extent that workers are informed about change going on in their organisations and invited to participate in those decisions. Emotional demands could be about confrontation with emotional material, or it could just be situations that they have to cope with in the workplace that are overly emotional or impact them personally. Job control is really about influence and how much they can influence what happens to them in the work environment. So I think these are really kind of complex hazards to think about, but as we can see, they're sort of popping up quite high overall, and so would be worthy of further exploration. Now, what I will say, though, is that the profile of these hazards varies for different worker groups. So, for example, managers tend to report higher demands, but also higher resources. So maybe that balances out the risk of harm for them. But again, I think it's worth thinking about in your organisations. Are you looking at what's happening for your managers? Are you really clear about whether you have sufficient controls in place for those groups? If I give you a bit of an example of that, so employees, when compared with managers, are more likely to report poor change management and low job control. So they're the ones kind of showing up in these moderate risk resources. So we see about 80% of workers, so employees, reporting low job control compared with only 64% of managers who report that one. And similarly on change consultations, 71% of workers report that compared to 64% of managers. So you can start to see where some of those differences pull through. Another group worth paying attention to is those doing long hours. So think about if you've got people in your organisation working, 40 plus hours, we see in this data, we can see that they're at higher risk of experiencing or reporting things like role overload, emotional demands, role conflict. They also are less likely to be reporting that they've got good support or good recognition. So again, back to that point of interacting demands, these groups of workers are not feeling well supported. Another key piece of data that's collected through the People at Work survey are measures of the risk of psychological distress and burnout. What we notice is that it appears that there's a substantial segment across our workforces who are struggling. So if I look at the one on the left, we can see in the Comcare scheme there's about 30-odd% categorised as being in that high to very high distress categories. So this indicates kind of moderate symptoms, but also sort of some distress or need for professional help. And then similarly, there's also about 16%, I think it's about 1 in 6, at high risk of burnout. What's important about these numbers is the way that these are calculated. These numbers don't necessarily mean that these will translate into injuries or potential claims, but I think it's an indicator of distress. And that might have negative individual impacts, but also potentially negative organisational outcomes, such as engagement and productivity. The other thing that's interesting here is that what we're seeing is that the Comcare scheme is fairly similar to the national picture, and that's the national picture as collected through all of the people at work data. But we are seeing it higher than what's collected in sort of national wellbeing surveys. So the numbers here sort of seem to be coming out a bit higher. So we're going to explore that a bit further and try and understand that. I guess some other kind of caveats to these numbers. I think I don't want to create panic, but I do want to sort of point out a couple of things. I think there are strong correlational relationships between a number of the hazards that are measured in people at work and these outcomes. However, people come to work with all sorts of external influences, some positive, some negative, and all of that will be reflected in the way these questions are asked. So it may not be that work is creating these levels of distress and or burnout. However, this still indicates that our people are maybe not coping, or a portion of our people are not coping as well as they could be. That may be due to external factors, but I think we as employers still have a role to support them. That's good for workers, it's good for employers, it's good for sort of everyone all around if we do that. So I think that's the key takeaway here. I think I'm going to wrap up my bit of this session talking with a few key takeaways from this data. So I think generally we're seeing the frequency of exposure to hazards measured in people at work is low to moderate risk. We're not seeing a lot of high risks, though we are seeing that sort of third of the working population potentially at risk of distress. Now, the hazards that we're seeing that appear to relate most strongly with distress are things like role ambiguity, emotional demand, conflict, supervisor support, and that change consultation bit. But that risk profile varies for different segments of the population. So again, think about your managers, think about people who are working longer hours. We also see a really significant overlap in the experience of hazards. So where we're seeing one, there are others. And again, that relates back to what Luca was talking about before, about the interactions of those hazards. What does that look like? We also see that procedural justice appears to be fundamentally important. While it does show up as a low risk, it actually is really highly related to a number of the other hazards that are measured. So I think that means that if we start to see increases in people experiencing poor procedural justice, then I think that will kind of interact with people's experiences of these other hazards and perceptions of what's going on in their workplace. So lastly from me is a brief advert. So just talking about that, we intend to explore people at work further in the upcoming mental health community of practice events in June and July of this year. The sessions are going to explore the process of implementation of people at work in a bit more detail and give attendees a bit more of a hands-on experience. If you're keen to participate in these, please reach out via the mental health program at Comcare email that you can see on the screen and may get posted in the chat. And hopefully we can see a few of you there. So that's it for me. And at this point, I'm going to hand over to Anne, who is an experienced senior clinical psychologist in the APS Mental Health and Suicide Prevention Unit at the APSC. She's worked in private and public sector areas, including service delivery, organisational development, stakeholder engagement and advisory roles. In her role of building mental health capability and supporting implementation across the APS, Anne has co-authored the Address tool, an APS model for responding to psychosocial hazards, and developing guidance on creating psychological safety in teams. She's also overseeing the Compassionate Foundations and Connections e-learning suite. So any of the APS guides, sounds like Anne is the one to talk to. Thanks, Anne, over to you.
Thanks, Dana. Good morning, everyone. And thank you for the opportunity to present on behalf of the Australian Public Service Commission. I'm presenting from Canberra, Ngunnawal country, and I'm here to present you a presentation on Address, an APS model for responding to psychosocial hazards, including an overview of its purpose, the development of the suite, and how Address can be utilised strategically within APS agencies and portfolios. Before I start with my presentation, I'm conscious the audience here today are from a variety of professional backgrounds and organisational contexts. The model that I'll be speaking to has been specifically designed for the Australian Public Service and is an example of how our team explored the possibility of supporting agencies with their duties and responsibilities to ensuring a psychologically and physically safe workplace environment within the context of legislative and model code changes. As this model has only been released, we have not considered this model to be repurposed for use, such as in other jurisdictions or organisational contexts. ADDRESS, as you can see, is an acronym with each letter representing an area of job design to help agencies understand how particular factors contribute to psychosocial hazards in a work environment. Good work design or job design is the foundation to creating physical and mentally safe workplace environments. How we design roles, tasks, and the environment workers are in may support the elimination and prevention of psychosocial hazards in the workplace. This model has been designed with significant agency consultation, so it's fit for the APS operating context. This included a secondary review panel, which consisted of various agency representatives providing feedback, pilot testing at 2 APS sites, and close collaboration with Comcare and Safe Work Australia to ensure the language and information was consistent with the model code of practice, managing psychosocial hazards in the workplace, and work health safety legislation. ADDRESS has been developed to support agencies to take practical steps to identify and assess for the psychosocial hazards by using existing organisational data, as well as to implement and review the efficacy of their control measures. Each letter in ADDRESS represents autonomy, which refers to the level of job control an employee has, such as control over working conditions, location and environment, tasks they perform, and level of influence they have into existing processes or work outcomes. Define refers to job design elements, such as the opportunity for the employee to complete a variety of tasks and use problem-solving skills. It includes the extent to which there's role clarity, considers factors relating to role conflict, as well as the ability of the staff member to provide informal and formal feedback through a range of mechanisms. Demands refers to the extent to which a role has reasonable job demands, including consideration of time pressures, role over or underload, and if the role creates emotionally demanding situations. The factor also captures mechanisms for decision review, perceived procedural justice, fair decision-making opportunities, and physical demands on the employee. Recognition refers to the extent that positive feedback, acknowledgement of effort, and recognition from supervisors is received. It also includes whether appropriate remuneration, monetary and non-monetary, is available, and whether rewards are distributed fairly and worker skills are recognised. Finally, it includes organisational policies being applied fairly and consistently. Exposure refers to the extent to which a role involves working with potentially high-impact emotional material or being involved in situations involving violence, horror, torture, or abuse through a range of mediums, including reading about, viewing, watching, or listening to story. This includes working in situations where employees may feel their personal safety is potentially at risk. Support refers to the amount of support, including practical assistance and emotional support that staff receive from their colleagues and managers. This includes the extent to which someone understands how the purpose of their role connects with the broader organisation. Strengths recognise existing mechanisms that support the elimination of psychosocial hazards. This may include strong organisational team cultures, access to flexible working conditions that support work-life balance, and more. The diagram shows on a page how ADDRESS Suite operates. There is a circle with 4 quadrants labelled Identify, Assess, Control, and Review. Supporting this model is staff consultation and manager commitment. The model is made up of guides and supporting resources which step the responsible staff through the Identify, Assess, Control, and Review processes. Each step has a tailored guide that agencies can opt in or out of utilising, and it's meant to complement existing work health safety practices. Our target audience being HR practitioners, managers, work health safety, and HSR teams. So the steps in detail. Step 1, identify. Included in this step is a guide and 2 screeners agencies can choose from to support the identification process of psychosocial hazards. One of the unique features of the ADDRESS model is the use of existing APS organisational data to support agencies with the identification of psychosocial hazards. By consolidating existing data like census results, you'll build a picture of what areas you may want to target first as your top priorities. For agencies where census data is not available or suitable, for example, the small work area, there's been significant restructuring within the last reporting period. An alternative 30-item hazard identification screener has been developed that supports the assessment of psychosocial hazards against the address framework. Step 2 provides tools to verify whether existing data is an accurate representation of your workforce experience. This is done through staff consultation, and we've developed a PowerPoint and talking points to support your facilitators through this process. Once you have further data here, you can begin to plan and action control measures to focus on the continuous improvement of job design in your agency. This is where step 3 comes in. This section requires a bit of deep thinking and research into what will work best in your agency. Step 3 tools provide a guide on how to create an action plan to address the psychosocial hazards already identified. It provides guidance on what activities and actions that could help mitigate the identified psychosocial hazards and some example control measures which agencies may wish to implement. Step 4 allows agencies to evaluate their progress in improving their overall job design. This is done again through staff consultation and encouraging a feedback loop required to assess if the controls have been effective. This step is crucial to demonstrate alignment with the model code, and similar to step 2, there's a PowerPoint and talking points to help you through this process. All of these tools are adaptable to suit your agency's unique operating context, and the suite itself is a model that will be updated as required with any legislative changes to suit the user needs. To give you an idea of what some of our tools look like, here's a screener spreadsheet used in step 1, census psychosocial hazard mapping. Like all of our resource, there is a disclaimer and a set of instruction on what this document is section, which establishes how to use the document. This should be read at the beginning and returned to as necessary while using any process within the suite. The last tab, or the census heat map, is where agencies can copy and paste their census data. Make sure to follow the instructions for the formulas to work throughout the spreadsheet. You can see an example data already plugged in to show you how it operates. Moving into the third tab, Outcome Measure Pre-Screen, which shows the 3 outcome measures included in the APS employee census that may indicate a presence of psychosocial hazards. The fourth tab then maps each relevant census question to the complementary job design theme, as in autonomy, define, demands, recognition, exposure, support, and strengths. The positive and negative percentages from the census result will give an early indication of where agencies may like to invest further attention and prioritize the next steps. The fifth tab may provide an easier way of identifying if there are any significant disparities in scores across factors, and should be used in conjunction with the deep dive tab to inform decision making. Now, if you're wondering what you can do if you have a situation where census data is not appropriate or available, this is where our alternative screener in step 1 called hazard identification can come in handy. You may want to use this for smaller teams or for new units, or where there's been a lot of change since the last survey. As mentioned earlier, step 2 and 4 involve consultation and facilitation as part of reviewing the evidence of a psychosocial hazard and assessing the efficacy of the control. On screen is an example of one of the slides in the PowerPoint pack provided to facilitators for the staff consultation section, as well as talking points. The pyramid on screen demonstrates how address fits and can be implemented into an agency and what the supporting requirements will be, including leadership support, enabling corporate policies, good work design, risk control, and monitoring. Similar to most organisational change models, address requires leadership commitment and support for implementation success. We want our leaders to be role modelling and reinforcing what safe behaviours look like. Our corporate policies, practice, and procedures require some alignment to address. For instance, policies regarding how sexual harassment is reported and managed needs to be available, contemporary, clear, and consistent so that address can be effective when an incident of exposure is experienced. As mentioned earlier in the presentation, good work design can prevent many physical and psychosocial hazards from occurring. It may require a review of our existing role descriptions and regularly reviewing how work is delivered. Address provides tools to support agencies actioning a response to identified psychosocial hazards, which is aligned to good work design. It provides a framework and focus to support agencies considering and demonstrating how they are working towards alignment to new legislative and model code changes, and working towards creating safer spaces for all staff in the APS. These tools are designed to help identify and eliminate psychosocial risks, which is a priority for employers. Our hope is the address model provides agencies with an opportunity to approach psychosocial hazards with intention, data, and clear goals. What we have tried to do is simplify what can be a complicated process by making it easier to understand and action. Understanding organisations have varying amount of dedicated resources, our hope is that our guides and tools can identify where investment is best placed so that control measures can be implemented in areas that need it most, with the intent that this process is continuously improved upon with each action item and generalised the entire organisation. Address is available at no cost to APS agencies and discoverable on APS Learn, which is our learning management system, under the APS Mental Health Capability Hub. That brings me to the end of my presentation. Thank you for the opportunity to present. And on screen are our contact details in the event that you wish to contact us with any further questions or inquiries. Thanks.
That's great. Thanks so much, Anne. There's so many great resources there. Hopefully that people will have found that useful. I am now going to hand the baton over to Dr. Amy Zado. We're very pleased is able to join us today. Amy's an organisational psychologist and lecturer at the University of Adelaide. She's also a senior research fellow at the Psychosocial Safety Climate Global Observatory, which sounds very grand, at the University of South Australia. Amy's been an active member of the Burden of Disease Project with the World Health Organization and International Labour Organization, and has extensive experience in the area of psychosocial safety climate interventions. Thanks, Amy, for coming along to talk to us today. Over to you.
Thank you. Just take control. Okay, hello everyone. As you know, I'm Amy Zado, and I'm going to be talking to you today about psychosocial safety climate. And I'd like to acknowledge as well my work colleagues, Professor Maureen Dollard and Daniel Neser, and my other colleagues who I'll be sharing some of their research today as well, and they've certainly helped with this presentation. So what is psychosocial safety climate? In a nutshell, it's really the organisational climate for workers' psychological health and safety. And really it's about sort of the infrastructure of the system of operation in an organisation that protects worker psychological health. So it's very different to psychological safety. A lot of people merge the two and get mixed up. And so I thought I'd just differentiate between the two so that you're really clear. Psychological safety is really about feeling safe to speak up. If you've got a concern in the workplace, you feel that you can raise the concern. If something's being done that you're not happy with, you can say, this is unsafe, we need to do something about that, and you feel safe to raise that concern. That's very different to psychosocial safety climate, which is really about the infrastructure around psychological health and safety in an organisation. And it's really the safety system for psychological health. So that's the difference between the two. So being organisational psychologists, we like to measure everything, quantify everything, and provide psychometric validation for the tools that we use so that we ensure that we follow evidence-based practice. So this is the psychosocial safety climate measure. There are 12 items. They're measured on a 5-point scale from strongly disagree to strongly agree. And within the scale, there are 4 main domains. And the domains encompass management commitment. So it's around, what happens when a concern is raised, what kind of processes are in place. There's management priority, what kind of feedback and vision is provided in the organisation around the protection of psychological health and safety, what kind of communication processes there are. And quite often organisations that we meet with say, we're really good at communicating. We're constantly sending out messaging to staff about what they need to do. But what is often underdeveloped is the process where staff can communicate their concerns back. And we usually need to spend a bit of time working out those processes so that they're very clear and transparent for employees. And then organisational participation and involvement around psychological health and safety. How do people get involved? How do they get involved in setting up the structures to protect psychological health? And it's really important that all of those 4 domains are considered in order to generate a strong psychosocial safety climate in an organisation. Being organisational psychologists, we do a huge amount of statistical modelling. And what we can see is that the psychosocial safety climate predicts the job demands and job resources that we see in organisations, and subsequent health and engagement and productivity and motivation. So really, if you're really interested in primary prevention, focusing on the psychosocial safety climate is a really good way of preventing hazards from emerging. And we can see in our data, we run longitudinal models and cross-lag models, and we see in our statistical modelling that the psychosocial safety climate of an organisation can predict future hazards 1, 2, 3, 4 years later. So we can measure and benchmark the psychosocial safety climate, and that gives us a perception of where things are going to be and what the state of someone's psychological health might be in 4 years' time, for example. And even yesterday, I was running some statistical models that were showing these relationships. And I've run a meta-analysis as well, looking at the data from around the world across 16 countries, and these relationships were supported in the meta-analysis as well. So we have really strong sort of academic evidence-based knowledge behind the use of this tool. If you're interested in the tool and more information around it, I have a QR code on this slide, and you can use that to access the website, which has all of the information around papers and descriptions that might be a useful resource for you moving forward if you're interested in investigating this tool in more detail. And just a bit of background around the tool as well. It's included in the US Quality of Work Life Survey, the Job Content Questionnaire, various workplace barometers. So it's widely used as well. And we really like that fact because we like to build up a body of evidence to support the relationships. One of the key aspects of the psychosocial safety climate tool that's really useful for organisations is that we can benchmark them against Australian data. Maureen Dollard has been involved in a study called the Australian Workplace Barometer Study, which has been following 7,000 people since 2009 across Australia. And these people were randomly selected from the Australian population. So it's very, very high quality data. And using that data from the Australian Workplace Barometer, she's been able to develop benchmarks for psychosocial safety climate. And they've been rigorously tested in the academic literature. You can see here that if people receive a score of 41, and this is basically adding up their scores for the 12 items that I've shown you just before, if people receive a score of 41, then they're considered to be low risk, which means that the psychosocial safety climate is relatively good in their organisation. Their future psychosocial hazards are likely to be low, and they're less likely to develop psychological health symptoms, work-related psychological health symptoms down the track. However, if you see groups within an organisation that are in the pink or the red zone, then this is a significant area of concern. If people are scoring less than 37, we would get involved with some actions because this suggests that they're in the high risk zone for psychosocial safety climate, so that there's a possibility in the future that their group's likely to be exposed to psychosocial risks, and that there may be a percentage of that group that would be likely to develop psychological health symptoms. And if someone scores less than 26, then we're really concerned, and that's when we would get involved with some urgent action to undertake. So this is just one of my papers that I published, and this is a really interesting one because I was working with the World Health Organization. We were looking at the impact of long working hours on future major depression. We're expecting that there would be a relationship. And this is really important at the moment because a lot of people are working out of hours because of digitalisation of work. People can access emails, Teams from home. There's this social connectivity to work, and some people find it really hard to disengage from work. So we were interested in how the longer working hours impact future major depression. And we discovered there wasn't enough data in Australia. So I ran this study, which is published in BMJ, to ensure that we had more data and representation from Australia. And the interesting thing about this is what we were expecting to see is that long working hours would predict future cases of major depression. And this is a really high quality study because we randomly selected over 1,000 people from the Australian population, and we excluded anyone with pre-existing symptoms of major depression. So we're only interested in new emerging cases. And what we found is that the relationship between long working hours and future emergence of major depression, there was a relationship. It wasn't huge. But what was really significant was that people who reported working in an environment with a low psychosocial safety climate were 3 times more likely to develop major depression symptoms over that 12-month period, like new cases, people who hadn't had it before. So it's a pretty powerful tool to think about. And as you can see here, this is how psychosocial safety climate sits more broadly within policies, globalisation. So you can see that these things have a relationship, and we have some studies exhibiting these relationships. And one of those studies is this one. And this was a study completed by one of my colleagues, Rachel Potter, and she found measuring national policy approaches around workplace mental health around the world, that there was a relationship with the psychosocial safety climate. You can see here places like Sweden and Finland had a lot of national policy approaches, and their workers also reported high levels of organisational PSC. So there was that relationship shown there in that graph. The interesting thing that we've also found, and we're still investigating, is that we see a relationship between the psychosocial safety climate and physical health as well, in particular musculoskeletal disorders. And this is just a really complicated diagram to show that the psychosocial safety climate reported by a group of people in an organisation was related to emotional exhaustion and future musculoskeletal disorders, and also workers' compensation claims. So not only does it have a benefit for psychological health, there's emerging evidence to show that there's a flow-on effect to physical health as well. And the numbers show that it's important to do because you can see here that it impacts productivity. Not only does it impact psychological health, but it's bad for business as well if you have a low PSC. So you have a higher sickness absence. People who are working in low PSC environments tend to have, around 20 more hours annually of sickness absence than people working in high PSC environments. So there's a much greater cost of productivity. But then there's also this problem with presenteeism as well. People who turn up to work, they just don't really feel productive. They feel exhausted. They don't have energy. They feel like they can't put in a really hard day's work. And this is called presenteeism. And we see the impact of presenteeism as well in these organisations. And here's just some more calculations around sickness absence as well. I won't go into a lot of detail, but they're on the slides if you want to unpack those at a later stage. And the other thing that PSC is related to is turnover as well. So we see in low PSC environments, we see higher levels of turnover. And as we know, turnover is not really good for business too. So this is something that we need to think about as well. And then finally, we see relationships with performance too. So workers working in high PSC environments, their supervisors report that their performance is greater. And this is just some emerging research, some new research that we've been doing recently, and we're starting to see that relationship as well. So how do you build PSC? Some people use radical approaches. There's an organisation in New Zealand that talks about reducing the working week to 4 days. And I know there's been a bit of media attention around 4-day working weeks, and they did notice that PSC increased. So this is a radical organisational change, not necessarily evidence-based, but you do see impacts on PSC when these types of things occur. What we normally do in our work is we use a very systematic evidence-based approach. And the key approach that we would typically use is firstly capacity building. And this is really a training workshop, some kind of training across representatives in the organisation so they understand exactly what PSC is, how it works. And then after that, we run an assessment and do some benchmarking, and we benchmark across different groups within an organisation. We benchmark across employees and leaders and across a range of different demographic variables depending on the organisation. And once we have the benchmarking done, we do individual reports for each group, and we sit down with groups and develop action plans. And they're very, very systematic. We have like a spreadsheet that we set up. We have each of the PSC items listed, and we work through them systematically one by one and develop a set of actions for those particular items with employees. And the items vary from some pretty high-level actions, revising policies, for example, to some really simple things that often have a huge impact too. Things like raising wellbeing in staff meetings, leaders walking the floor, being more engaged and providing more social support to staff, knowing their names, asking how their weekend was. Some things are really quite simple and some things are more complicated, and we usually have a mix of each. And then the issue with action plans is that often people are very, very busy. They have a lot going on and they need a lot of support. So setting up mentoring and coaching is pretty important. And what we have found works well is a community of practice. So setting up a community of practice where people get together and share their findings. And people will often find that something works well and they'll share it with the group, and the group might try that as well. And so it's really about developing that shared network of understanding together. And then what we do after that is then we run the process again, we measure PSC again, and we look at improvements in PSC. And we've had some organisations and some people that we have worked with who have really done a wonderful job with this. And have successfully navigated this process really well. And an example of one study, and this is published in a really high-level psychology academic journal that shows how PSC can be built using that process I've just described, is here. So the top line of this graph shows how that PSC was sort of sitting at under or just above 39 before the intervention took place. And then at the end of the intervention, it was 43. It was in a really wonderful place. But what we did find very interesting, or what the researchers found in this research, is that COVID struck at time too, and the control group started to increase too. And we have a lot of speculation and ideas around why the PSC would have improved during COVID. And we assume that this might be due to greater attention to psychosocial hazards during that time, more check-ins, people working from home. But it's just an interesting finding that I thought I'd share with you. The other thing that is really interesting as well is that we can see that EAPs, if you look at the top line of this graph, you can see that when EAPs become involved, that the level of psychological distress of an employee reduces. But if you look at the bottom line, you can see that in an environment of a high psychosocial safety climate, it reduces much more. So we need to think about when people return to work after having a psychological health problem, we need to think about the climate that they're returning to and how can we build a really strong, supportive psychosocial safety climate to help in their recovery. The other thing that we found in our research and in our interventions in the field as well is that we see that leaders and workers see PSC differently. And this is quite important because quite often leaders initiate and approve interventions. So what's happening here is that we can see that division leaders and branch leaders are pretty much in the green. They're reporting a psychosocial safety climate of 41 or above. But look at the workers, look at the staff and see the difference here. So there's a disparity between perceptions of PSC. The issue is that the relationships with future demands, resources and health are much more strongly related to the staff perceptions than the leader perceptions. So some of our interventions need to align the leaders' perceptions with the staff perceptions for a stronger impact. And one of the ways we've done this in the hospital system is we've set up an interactive dashboard for staff. And because this is in hospitals and people are not sitting at computers, we have iPads at workstations, and staff indicate the PSC on a 4-point scale during the day. And the interesting thing about this approach is that this is provided in a dashboard to management, and management can see dips and fluctuations and know when to intervene and set up processes of support. And this has been really effective. There's certainly been some dips, and managers have been able to become involved and understand why those dips are occurring. For example, you know, in one case, there was a particular time of the week where things are a lot busier, and they were able to prevent that from creating a low PSC by putting controls in place earlier. And so this is just really a way of communicating concerns with management in a very live way. There's a whole heap of recommendations here around PSC. Ideally, you know, we would love for people to use it, and we'd love to make it available to people so that they can use it regularly. We'd love it to be a KPI in organisations. We'd love it to be used to evaluate the new psychosocial regulations. There's a whole range of different ways that we would love to use it, and we're really hoping in our future work that we can work on some of these areas too. So there is a QR code there. So I noticed in the chat as I was talking that someone mentioned that the website's difficult to understand. So please email me if you have any questions or concern. Please email me, and I'm really happy to provide the tool, papers, information via Comcare, and they can send it out to you as well. Anything I can do to help, I'd be really happy to do so.
Great. Thank you so much, Amy and Anne and Dana, for that really interesting session. There were lots of questions about the tool and their use in the chat, some great contributions and insights, even some offers to connect and share direct experiences of using the tools. Amy, you also mentioned that communities of practice were great, and in our chat, we also mentioned that we are having a community of practice event, which we'll repost again in the chat. Dana mentioned that as well. So now, however, we've got the opportunity to talk to Vicky Bates, which is really exciting. Because we're looking at case studies of people at work and how it's been used. So Vicky's really generously offered to share her organisation's experience in using the tool. And Vicky's currently Director of Employee Wellbeing within Services Australia. She's leading a small team striving every day to make a difference in the lives of their colleagues. She's also studying a diploma of counselling to consolidate her lifelong experiences to help others who may need some guidance when things get a little or a lot challenging. Having a self-experienced burnout, she's passionate about shining a light on the importance of taking care of yourself and being aware of the early signs and symptoms of mental health distress. Early intervention and prevention is so important for all kinds of illnesses, and mental health is no different. Together we can make a difference to help lower the stigma that can come with living with a mental illness. Vicky, welcome. Just mute. That's it. Thank you.
Sorry, that is a public service faux pas, isn't it? You're on mute. Thank you very much for that introduction, Andrew. Very much appreciated. As Andrew said, I am the Director of Employee Wellbeing in Services Australia, and I would like to say Yuma and good morning. I am also coming to you from the beautiful lands of the Ngunnawal and Ngambri people here in Canberra, and an amazing time of the year in autumn. I'm sure that my colleagues on the session from Canberra will agree that the colours are just amazing. So I have been asked today to give you an overview of Services Australia's experience with the People at Work tool that Dana has presented on this morning. So thank you for that. I'm providing an organisational case study by Services Australia. Before I get started with our experience, I thought it would be really useful to provide some information on what we do here in Services Australia and the amazing services that we provide to 99% of the population of Australia. So we support our fellow Australians by delivering payments on behalf of the government, including through Centrelink, Medicare and the child support programs. We also provide services to assist other Australian government services and services that they introduced, for example, phone voting during the 2023 federal election, which was a really great experience to be a part of. So when the people the public are dealing with us, they can expect quality information, respect, honesty, integrity, and efficiency, being mindful that in 2022-23, we had 26.7 million Medicare customers. We had 9.5 million Centrelink customers, 1.1 million child support customers. We paid out a total of $21.5 billion. We handled 55.2 million calls. We processed 465.6 million claims, and we had over 10 million service centre engagements during that period. So to be honest with you, I'm exhausted at just reading that data, and I forgot to click onto the next slide. So that slide summarises the information that I just provided to you guys. So moving on to the second slide, I do need to say up front that we piloted the People at Work tool in early 2022. So there may be some enhancements that have been made to the tool since we used it. So please be mindful of that as I go through the presentation today. So in late 2021, our executive made a decision to commence a psychological wellbeing survey pilot. And with such a large organisation, it was important that we ran a pilot just to get a sense of whether or not it would be beneficial for our agency. And in that pilot, we actually used 3 tools. We used the People at Work tool, we used the PSC tool that Amy has spoke so wonderfully about today, and we also used the Maslash Burnout Inventory, which is a 22-item survey covering 3 areas: emotional exhaustion, depersonalisation, and low sense of personal accomplishment. So the decision to go ahead with this psychological wellbeing survey was in part to a downturn in APS census results, increased absenteeism, and poor engagement in some areas within the organisation. The employee wellbeing team and the safe service design team were tasked with rolling out the pilot in 2 business areas, and to get a really good idea of how the pilot would roll out, we decided to do the pilot within an enabling area and within a service delivery area. It was decided that the pilot would be available to our people division and our wonderful colleagues in the social work services branch. I am just going to have a drink of water. Now, I won't go over the People at Work survey because Dana has done a brilliant job about that this morning, and the same with the PSC 12 tool that we use, because Amy has also given us some brilliant insights into that tool. The tools that we decided to use would help us get a sense of risks within the workplace in terms of psychosocial safety and the potential for burnout, emotional exhaustion, and poor work engagement. So all very important and useful tools in my view. We were very lucky to partner with Amy and her colleagues at the University of Adelaide, the Centre for Workplace Excellence, who assisted us in rolling out these components of the pilot. As with any pilot, there was a lot of work to be done in the lead up to launching the pilot. Given the number of survey tools that we were using, there were a number of internal and external stakeholders, which thankfully all came together to make this pilot a success. We wanted to make sure that we got it as perfect as possible or as right as possible so that we weren't wasting people's time. The work that we went through leading up to the launch was configuring the People at Work tool where we could to make it fit for purpose for our business areas, engaging the University of Adelaide, as I mentioned. We developed a very comprehensive communications campaign that was clear as possible to entice our staff to participate. We got our SES leaders involved so that we had some weight behind the tool. Participants knew that our SES were very keen to get their insights. We decided to keep the survey open for 2 weeks and then in the end decided to extend that by a week with additional communications rolled out to assist in increasing participation numbers. So during the period of the survey, we had available participation rates provided to us from the University of Adelaide, which was great. We were able to provide some insights to our executive throughout the course of the pilot. We did run some focus groups, which is actually a recommendation with the People at Work tool. And running these focus groups gave the participants an opportunity to validate some of the answers that they gave in the surveys, and it also gave us a really good a data set, if you like. Our focus groups were led by our wonderful colleagues in the Safe Service Design team, who have, which includes a number of allied professionals, which was really good. As I said, the focus groups enriched the data that we were capturing and were really beneficial for our staff to be able to have a voice. When we did receive the reports from People at Work and from the University of Adelaide, we did undertake an analysis of all of that information, tried to pull it all together into a succinct report for our executive. We did provide verbal briefings to our executive at the end of the survey period, which were very well received by our SES, and it also gave them an opportunity to ask us questions around how the pilot went, the pros and cons, I guess, in relation to the pilot. After the pilot, it was identified that a broader rollout of the psychological wellbeing survey using the 3 tools was not really beneficial to roll out more broadly, given the number of staff within Services Australia at the time. I think there was around 33,000 staff, and there were some limitations that I will talk about on the next slide with the People at Work survey tool that we found a little challenging to get through, and I will emphasise, again, in a very large organisation. We decided that it would take a significant amount of time and resources, so this would mean a lower value return on investment. And the findings of the surveys identified a number of areas that we were already aware of as an agency, and we felt that it was more important to put those resources into identifying strategies and tools that would help our colleagues. So, as with many pilots, we did learn a lot, which is a good thing, I guess. I guess that's why they are called pilots. We determined that while the People at Work survey tool is simple to use and very, very user-friendly, it was not fit for purpose for an organisation of our size. So I will start with some positives. It is a great resource. The guidelines that you can get on the website are just amazing. And our colleagues in Comcare, Dana and her team, were great in terms of providing us assistance when we were starting to prepare the pilot for rollout. Some of the concerns that we did face, though, each profile that we created only allowed for one survey to be undertaken. So in order to do the pilot in the two different teams, if you like, we had to have two people create the profiles to get the links. Now, if we were to roll that out more broadly within Services Australia to, let's say, 20 divisions, then we would need 20 people to create profiles to get the links that we needed. There was a limitation on the work groups that you could use, which, given the number, it didn't allow for our agency to roll it out more broadly. For example, if we had 20 branches with 40 different teams, we weren't able to get aggregated data to, get some really good insights into what was happening in different pockets of the organisation. The other issue that we came across was that the position details that we would have liked in the tool in terms of role types was really not able to be done. It was very limited. We have such a diverse workforce that would have been really good to be able to, drill down to how our customer service officers in the front line were finding their experiences at work. So we were, in the end, we made a decision to go by levels of staff rather than the roles that they were undertaking. Unfortunately, also with people at work, we weren't able to draw down progressive reports, so we weren't able to do any targeted communications to people that we were asking to participate. So, for example, if a team, their participation rates were a little bit lower than others, we weren't able to identify that and then do some targeted reporting. We found that was a little bit, disappointing, I guess, but not the end of the world. Staff found that using the tool was quite easy. The links obviously all worked quite well. We didn't have any issues in relation to that. So while the tool does provide information in relation to individuals' thoughts on their psychosocial safety and can identify pockets of concerns, in my view, it would have been not enough to help us identify the specific risks impacting our staff's psychosocial safety. So we gave consideration to using the tool. I would recommend that you give consideration to using the People at Work tool in conjunction with other tools that can enhance the findings, such as the focus groups that we did, community as supports, that kind of thing, maybe even Viva Engage posts. The other matter that we learned that I think is really important to share with you all, that I would not recommend that you include numerous links in an email to staff asking them to contribute. I believe that may have had an impact on the participation rates. I'm not sure. Staff may have seen the first link to People at Work and then didn't recognise there was a second link, or thought maybe they'd come back to the second link and didn't get an opportunity to do that. So a very strong recommendation to me, if you are going to go out and do some surveys, do one at a time. I have heard that from smaller agencies that the People at Work tool has been great for them. So if you are a small organisation, definitely give some thought to rolling out the People at Work tool. I think I've gone back one too many slides.
No problem, Vicky.
I didn't keep up with my slides, so my apologies. So we did, learn some really important things going through the process, and I hope that has helped others who are thinking about rolling it out. And thanks for the opportunity to share our experience. Really appreciate it.
No problem. And thanks, Vicky. An individual lived experience and organisational experience is just so helpful for people to get some insights into the practicals of, how to, what to expect, and what you might get out of these tools. So that leads us into our final session for the forum, which is about discussing identifying psychosocial hazards and risk assessments. And the session today, the panel today, is going to be including Dana, who you've already heard from, Anne, Amy and Vicky. And what we'll be doing is we'll be looking at some of the questions that have come through the registration process, and we may reflect on some of the comments that have come through the chat so far. So welcome, guys. I'll get you to put your cameras back on and we'll have you guys on board in no time. Terrific. Welcome back. Thanks. Yeah, we've had some great engagement so far, and really sort of reflects on some of the questions that we've already done a little bit of preparation for because they came in through the registration process. So the first one I'll throw out there is for Anne, which is, has the address model been validated and has been updated in line with guidance provided around the model practice around psychosocial risks at work?
Thanks, Andrew. So as mentioned in the presentation, the address model provides a conceptual framework and tools to identify and support the elimination as reasonably practical of psychosocial hazards within the workplace. And we have undergone external review and pilot testing across 2 OPS sites. And we had some help and support from Comcare and Safe Work Australia. But further updates and validation will be conducted through consultation, research and analysis once the model code managing psychosocial hazard has been released and when the APS agencies have had an opportunity to use the suite.
Yeah, great. Thank you. And there are some comments about getting copies of slideshows, which has come through quite a bit. So we'll just make sure that everybody knows that, yes, definitely there is a recording that it's being made, and it will be made available after the forum, as with all of the slides as well. There were some network degradation issues that had happened beyond Comcare. I understand that they have been resolved now, but those are the sort of things that can come and go and come back again. So the next question we've got is around recommending a well-benchmarked measure for assessing cognitive demands in the workplace. This one's for Dana, seeing how it's been dropped from the People at Work survey, and that did also come through the chat as well as one of the registration questions. Dana, did you manage to do some research on this one and find out anything?
Yeah, it's a really great question. And I think we're probably all aware of that there is some sort of research these days that the today's jobs are more cognitively demanding than they ever have been. So it is a really good question. I did have a little look around. I think what I tried to understand is what was going on in the early days of People at Work. So I did find that, it was interesting looking at the original report. So cognitive demand was actually the most prevalent hazard in the sort of, pilot testing of the People at Work tool. It was reported by something like 80% of the respondents, which, I don't know if that makes it easy or hard to work with. And it was consistent for sort of all groups of workers. What was interesting as well, that it was sort of, it had a non-linear relationship with psychological strain though. So it kind of wasn't a very, there was a, you sort of almost need like a moderate amount of cognitive demand, but not too much, or that's when it sort of turns around. But I expect sort of a combination of all of those things is probably why it, didn't make it into the final cut of People at Work. That's it on tools, and I'm happy for Amy to jump into. I think we, because I wouldn't call myself an expert, so there are a couple that we've sort of come across that seem to be sort of quite well researched. So there's obviously the tool that was used, the sort of question set that was used in the original People at Work pilot. So we can point you to that reference. And there's also another one that we've come across that is sort of reasonably well managed, is the NASA task load one that sort of has a number of different elements to it. But I am not sure that any of them that we've come across have any sort of Australian benchmarks that could be used. But again, Amy, it may be worth if you want to jump in on this one as well.
Yep, sure. So we often use the job content questionnaire, Robert Karasek's job content questionnaire, mainly because Maureen Dollard's done a lot of work with him, so she's very familiar with the tool. We have data from the Australian Workplace Barometer for for cognitive demands in relation to that tool. So that's a potential option. The interesting thing about demands too is that you can manage quite a high level of demands if you have sufficient resources. So there's an interaction, like a statistical interaction between the two. So I think the really interesting thing about this is focusing on reducing demands is probably not as effective as focusing on increasing resources or a combination of both. But it's a really great question to ask, very interesting, and the non-linear relationship between things. We see that all the time, Dana, so it's really good information. It's complicated.
Yeah. And I really like that, but like the balancing demands with resources, I think that's really critical. You can't just remove demands, that's not a thing, but what we can do is increase access to resources.
Exactly.
Thanks. So I've got another question here, which is, this one's to Amy, which is around, have we got a generic best psychosocial health and safety risk assessment to share with us for benchmarking purposes?
So you can use a range of different tools, and we've highlighted some of them today. So really it's about sort of identifying the psychosocial factors you want to measure in the organisation, and then determining the level of risk. And you can do that with the PSC tool or the People at Work tool. And there are a range of other tools as well, but the PSC tool is probably what I'm most familiar with. Very easy to benchmark with this tool. We have the benchmark. You really just add up the responses and then relate the score that you receive for particular groups against the benchmarks that have been developed. The tricky thing, and I think this is something that Vicky really highlighted very well, is designing the intervention is a lot of work. It's a huge amount of work. You need a lot of buy-in, you need leadership support, you need a lot of engagement, and it's resource intensive. So especially the People at Work tool is very, very, very resource intensive. So it's just sort of managing that process of designing the intervention. And then the key thing is evaluating your progress at the end. And we often do that by rerunning the scale and benchmarking again. But you can do it qualitatively as well through focus groups. But evaluation, you need to set up that cycle of continuous improvement around this process. And you'll win some and lose some. It's not always linear. Like some of the progress we see, is quite jagged. But if you see a gradual increase, then you're doing something right. And the evaluation will shine lights on, where you're improving. So you can keep building on that. But it is a complicated process.
Thank you. And you're mentioning interventions there, and the implication there is around controls and addressing psychosocial hazards. One of the universal sort of interventions that many organisations have are EAP, and I thought it was really interesting, the research finding that showed how psychosocial climate has an impact on the effectiveness of an EAP intervention or an EAP service. I wonder if you want to comment any further on EAPs and the impact there.
I would love to. I'm doing a project with the Employee Assistance Association of Australasia at the moment. A group of EAPs around Australia are working on interventions, psychosocial interventions. So, and it's an interesting process. I think EAPs have a huge amount of to offer in this space. But it's a lot of work, and so we're working through the process of building capacity in this area. One of the trickiest things I think that they have found, and Vicky alluded to this as well, is engaging staff. I mean, staff see another survey and think, oh, here we go again. We're already overloaded. We're really, we just don't have time for more surveys. So it's about setting up sort of systems of communication and support and processes that enable staff to feel that it's valuable and that they're going to get something out of it, that there's actually going to be some kind of enacted process that will really work. And we've seen really great engagement, and then we've seen not so great. And I think the difference there is there's a whole range of things, but sort of the rollout and media communication is really effective. Leadership engagement in the process is visible, transparent leadership support of the process really helps as well. Then what we also see, and this is very interesting, is that organisations with high PSE to begin with do better. Because they have the support, they have the resources, they have the leadership behind them, they have the priority, and so that it's easier for them to run with this process, and so it's much easier. But if you're starting from a point, where things are low to begin with, it's a lot harder to build that traction, and it takes longer. And that's just what we've seen at the moment.
Yep. Yeah. Anybody else want to weigh in on the EAP? Vicky, I can see you've taken Mark off.
I did take myself off. Not so much in relation to the EAP, but in Amy talking about the resource-intensive nature of this kind of work. We did do a survey in 2019. We came up with questions internally, and we had over 10,000 people actually respond to that. And I think that was an indication of, the sign of the times. People, health and wellbeing was coming to the forefront, that kind of thing. But unfortunately, we didn't actually give consideration to what we were going to actually do with the responses of 10,000 people and 500 pages of free text. So if you're thinking about rolling out a survey of sorts, it's absolutely critical that you have a think about what you're going to do once you get the insights from your staff. So I just wanted to add that little bit in relation to resourcing.
Thanks. Next one I've got here is around developing, how do we help employees develop and maintain healthy boundaries around work? For example, some people work when not required or asked due to their work ethics or passion for their work, but this can sometimes be, of course, at the detriment of their own mental or physical health. Dana, did you want to kick off with this one, and maybe Vicky?
Yeah, I feel like it's probably quite a bit to say in this one. It's a really great question. I am personally such an advocate for boundary setting. I think it's really, really important. And all of the research sort of backs that up. I think there's probably in response to that question in particular, I guess probably a couple of questions maybe to think about. Are you absolutely sure that that's the root cause? I think, yes, sometimes it can be about passion and work ethic, but maybe it's not. Maybe there is some sort of expectation around what, and I'm going to emphasize, inverted commas, like what does a good worker look like, or what's a good public servant look like? And are there sort of some inbuilt expectations about what that means, or what are some of the cultural norms that are in your organisation? Sort of what do your leaders do? What do they talk about? What gets praised? Who gets rewarded? I think there's a lot of that that'd be worth unpacking to be really sure that people are working the extra hours because they want to. And I think then a part of that as well is also then, are your people enabled to talk about it? Do your managers, do they have regular conversations about things like motivations, about work-life balance? Do you see good role models in your organisations? Are they good role models for balance in your organisations? Do people talk about their lives outside of work? I think there's really a lot to kind of unpack to check that that's really what was going on. We did publish a review late last year about the risks of hybrid working and what are some of the work health safety sort of implications of that. And in there is some references to some tips around boundary setting. So we can, I could probably find a way to drop that link in the chat. That might be worth looking at. Also, there's some Comcare guidance around good work design that can also be useful for upskilling your managers to sort of think about, do they understand their teams? Do they have these conversations? Are they able to sort of have some of these conversations? But yeah, I'd really challenge maybe that thought around people work long hours because they want to. I think maybe there's a bit of that, but I wouldn't be surprised if there's something more to it than that. But yeah, open to other thoughts as well.
Thanks. Vicky, do you have some thoughts?
I did, thank you. I just thought it might be useful to provide some insights from a person who has lived experience with mental ill health, having experienced burnout during my public service career. Setting boundaries, absolutely. I think we set boundaries in every aspects of our lives, whether that be at work, at home, that kind of thing. And unfortunately, those boundaries will be crossed. But I think it's about how we kind of bring ourselves back into our boundaries and what strategies and tools we have in place to be able to do that. There will always be something that needs to be addressed, unfortunately. So being flexible, obviously, is key in my mind. Strong work ethic is great. Being passionate about your work is also amazing, but it's also important to know when those things may become an unhealthy practice. So for me, I think it was a combination of work expectations, my own personal expectations, work demands, and my own personal demands. And when those two came together, I became quite unwell. So when I was recovering from burnout, it was important to be self-aware and know when those boundaries were being crossed, knowing the signs and symptoms that I was experiencing when those boundaries were being crossed, and respectfully declining invitations if I needed to, or being open and honest about how things were going for me in terms of my workload, my personal demands. Prior to becoming unwell, I thought that if Vicky Bates didn't turn up to work, the public service might fall apart. But the truth of the matter is that it did survive and without me, which is really good, I suppose. It was about becoming aware that I work to live and not live to work. It was about identifying and clarifying my priorities, what mattered to me and what was important to me, and staying true to those. And while work is very, very important to me, it brings me a sense of community and being engaged and contributing, and essential to me because I do have a mortgage. It became a little bit less of a priority after I'd become so unwell. So I guess I'm not saying don't be ambitious in your career or commit to something that you're really, really passionate about. It's just being mindful, I guess, of the brain oxygen that we can, deplete, and then not, I guess, re-energize that brain oxygen. So yeah, I introduced circuit breakers, very short circuit breakers that I do throughout the day, still do it, and would encourage people to, have a think about that in their spare time. Just be mindful, be in the moment, and, life happens. But yeah, boundaries, very important, but also important to know that we need to be a bit flexible. So thank you.
Fascinating, thank you. Really profound to hear your insights and your personal experience there, and very interesting reflecting on Amy's the research that you've been doing there as well around hours. That there can be some correlation, but not necessarily causation to those things. But it does present a signal to us as an organisation to investigate further and understand what's going on if there are increased hours that are starting to happen. Next one I've got there is for Anne, which is around if you could provide an overview of redesigning work or an example of redesigning work to manage psychosocial risks.
Cool. So I'll start by prefacing that I'm not an expert in job design. I think Comcare has already mentioned that they've got resources and training available for those interested in this subject area and want to know more. And when I think about the responsibility of redesigning work and work environments, that ideally sits with everybody. And it's important that it's done collaboratively with leadership, HR, and staff so that, cultural change can actually happen. And when I'm thinking of the address model in mind and how that could be applied to an example, one would be, for instance, say a team works with sensitive material information, which can be emotionally impactful. And if we were to use the address model, the closest psychosocial hazard would be exposure. Some of the suggested controls that would involve redesigning work could include exploring different ways to minimize that exposure, which will depend on the nature of the role of work, of course. If we're looking at exposure in terms of viewing, reading, or seeing emotionally impactful material, can we look at taking the sound out? Can we change the visuals or images to a different color or sepia tone? Can they be blurred where appropriate? Do we need to consider rotating our staff who've been exposed to this material, or limiting the exposure to who needs to know and for how long? What are some of the supportive structures that are in place? Because that's something else to consider. And I know this is a reflective question, but they're really aimed at thinking about how you can make changes to a work role. And another example I can think of, which might pop up quite commonly, is excessive workload, which is a common stress, and we know it's a source to burnout as well, as we heard Vicky talk about. So we need to think about redesigning work involving considering that the job roles and responsibilities are manageable and realistic. And it might include looking at, well, how can we redistribute work or reprioritize tasks if possible? Do we need to set clear expectations for performance with regular individual performance plans and reviews in place? Do we need to explore where are these demands predictable? Are they cyclic versus are they just ongoing sustained? So if we think about predictable or cyclical demands in a workplace, let's just say retail, for example, where they may recruit additional staff resources for those potential surge periods leading up to Christmas, as an example. There's really sort of no one size fits all in terms of what organisations can do. And much of the deep work and thinking is really about what's going to work for your organisational context and what controls would work best in order to improve that sense of reducing that psychosocial hazard and making sure that those controls are effective. So there's some ideas that people can think about and how a dress could potentially work.
Thanks, Anne. And I noticed there's quite a few links being dropped into the chat, and you also mentioned Comcare's website on materials on good work design as well. So thanks for doing that too. I've got a few more here, and we're starting to run towards time. So I might try to see if I can combine a couple together. So there's a couple here for Dana that we had you against, which was around a simple tool or matrix around duration, frequency, and severity. We had some comments in the chat there, also sort of highlighting that people at work might highlight the particular issue, but doesn't necessarily highlight the frequency and severity. But there's also another question further on, which we had around the effectiveness. How do you validate the effectiveness and controls without regular surveys or consultation? Or do we actually need regular surveys or consultation? It's a 2-for-1 deal.
Yeah, no worries. And I'll also probably just add on to the end of Anne's comments on the last one. I think don't underestimate, because I think, again, consultation is critical to this. Like, don't underestimate talking to your workers about what's going to work for them. I think that's kind of where you were getting towards at the end, was like, we might not have all of the answers, but the people who are doing the work are the ones who know the work, and they're the ones who know how to sort of help alleviate some of the sort of pain points and challenges. So you will not be surprised to hear me representing the regulator saying consult with your workers. Picking up on that question about a simple tool or matrix, well, wouldn't that be great? I think my first thought on that question is, in some ways, it's not simple. So I think some of these things that we're talking about in terms of psychosocial risks, how we assess them, how they interact, all of those things are probably, there is a lot of complexity in them. So there may not be a simple solution to what it is that you're trying to do. I think sometimes you just have to work through that complexity. Having said that, the model code of practice from Safe Work Australia does have a nice template in there to sort of capture your hazards, frequency, severity, duration. There's also a really nice tool that was developed by WorkSafe Queensland. So there's a psychosocial risk assessment tool. We can find the link and drop it in. It is quite thorough, but I think it's quite a simple in terms of kind of how it walks you through the steps to go through. So I think that's kind of a nice one. But also think about what tools are you using at the moment? What are you using to manage your physical risks or your other risks at the moment? How could you adapt them? Again, talk to your workers, maybe get a few people together to kind of talk about how you could adapt your current tools, given that everybody knows how to use them. How do you just kind of adapt them to make them work? And I think on that consultation point, it doesn't always have to be a survey is probably what I'd say. There are a number of low touch ways that you can reach out to your staff. Think about maybe surveying maybe just a sample of your workers, or talk to your HSRs, maybe use focus groups where you get kind of groups together to go deeper rather than trying to talk to everybody about everything. Also think about what other data exists. So what administrative data, like what HR data do you have? That's one of the things I really like about Address, is that it sort of picks up on existing data that's out there that can tell you something new. Think about, are your managers kind of monitoring at the team level? What are they doing through informal check-ins? How are they sort of collecting or contributing some of those data points? So sort of think a bit more laterally about how you might be able to collect data on this stuff. It doesn't always just have to be a survey. Those are the few things I was thinking about on that question, or that collection of questions.
Thanks. We might wrap up with just one final one, which will push us to time in a bit. But it really was around assessment processes for smaller organisations. But in the chat, we also had for scaling up for larger organisations. So it's how can we make sure these tools are size appropriate? So is there different tools for different sizes, or do we just need to do some modification of them? Amy, do you have any comment you want to make on this?
Well, I mean, my research area is psychosocial safety climate. So I always think that's a really great place to start, because it leads to everything else. And the advantage of it is that you have the 12-item tool, but you have an abbreviated tool now of 4 items as well. And so you can use a small abbreviated version for a small business. And the reason why I would argue that this might be a nice approach is that demands and resources, if people are working in small organisations, they have a diversity of demands and resources that might change on a daily basis. There might be so much fluctuation in terms of what they do. Sometimes it's nice just to look at the climate first and get a feel for the climate and work on that, and then gradually filter down to specific, specific demands and resources in the work environment. But that's just, it's a very sort of scientific evidence-based approach that would work really effectively for a small business. But there's a range of other tools out there too, and people could probably have some, feedback around those as well.
Terrific. Any closing words or final comments from anyone in the panel? Thanks so much, everyone. I did see in the chat there were some comments about it's important to recognise that it's not just the likelihood and consequences of hazards, that also it's worth considering the combination of hazards, that sometimes that can have an issue as well. Unfortunately, it's not always simple, so there is complexity to it. And we do have the magic answer. We'll be sure to share it with you. But we'll make it as simple as we can. There certainly is information and guidance material on Comcare's website, particularly around how to manage risks as well. So there is a code of practice around managing risks. I want to do a final thanks to all of our panel members. Thank you so much for joining us, for fielding the questions. Unfortunately, time's not unlimited, but we could go on for a long time because there's plenty of questions in there we could talk about. Thank you. In the poll will be popping up a last little poll, which is around what are your key insights or takeaways. So pop those in there as you think of them. We've popped in a number of links and into the chats around useful resources. We also have a range of training Comcare does, and you can find all of those, of course, on Comcare's website. Last few plugs. So we've got the National Conference is fast approaching, which is in August this year, and early bird tickets are now available. They're available for purchase until the end of this month, 31st of May. We've already announced that the former Sex Discrimination Commissioner Kate Jenkins and the renowned journalist Stan Grant will be presenting. So I'm pretty excited about seeing those guys. The conference website's got a lot more information, and we'll continue to add more as we go. The link is in the chat now. Your feedback, of course, is really important to us. It shapes the way that we deliver these events. It provides inputs into the themes, the topics and the questions that we respond to. There'll be short evaluation that'll be sent to you. So it's just 2 to 3 minutes. It'll be sent to everybody who has who has registered. There's also a QR code which is on the screen now. So I really encourage you to grab that. Just give us a quick few responses. If there's a topic that you'd really like us to present on next time, a presenter, anything else, we'd love to hear from you. We are definitely considering, we mentioned the mental health community of practice, and we're definitely looking at how we can include insights from those mental health community of practices into our next forum. So stay tuned and get watching for the next one. Thanks again. Stay safe. Have a great day, and I'll hopefully see you soon.